If you're up for it, I think that we would be able to do PRP today. So Vaughn has alopecia areata, which is a form of hair loss. I'm recommending PRP injections. PRP, platelet-rich plasma, basically is harvested from your own body. We take your blood, basically we spin it down, we separate the pro-inflammatory things like red blood cells, white blood cells, and then we leave behind the platelets because platelets have growth factors, and then inject it into the patient's scalp.
I don't like needles. I tried injections and it didn't work for me.
I would say we could always try. So the tough part about PRP is that it's not just one injection, it's multiple injections in your scalp. And it's not just one session, it's multiple sessions. It's also very, very painful. And I've seen people pass out.
It's just a lot.
It is a lot, it is a lot.
I will do it.
You would do it?
Yes.
Okay, all right. So we were just gonna have you draw some blood and then spin it down and we'll come back and inject it for you.
I'm worried about getting injections, but if that's the only way to get my hair to grow back, then I'll just go through it and just be patient.
Hello.
Hi.
Hi, how are you?
Good, how are you?
Good. Okay, so I'm gonna be drawing your blood. Okay.
The only thing I'm a little worried about it is if it's painful. I don't know, I don't think I have high pain tolerance. But I think I can do it. I had a child, so I think I can go through this.
All right, Vaughn, we have your liquid golds right here. So we're gonna go ahead and make you comfy. This is just a little vibration device that we use. So it feels like it's vibrating you right here, but I want you to use it like if you feel like discomfort, just keep it on your forehead. Your scalp obviously is a very sensitive area. So whenever I'm giving the injections of platelet-rich plasma, we use vibration to kind of distract the nerves from feeling that pain as much. Here we go, 1, 2, and 3. Stick there.
As I'm getting injections, it's super painful. Can y'all like pause a little bit?
Yes.
Okay.
Absolutely.
I don't know if I can do this.
Devin?
Yes.
Hi, I'm Dr. Singh.
Dr. Singh.
Very nice to meet you.
Nice to meet you too.
Come up here to the hot seat and let's talk about why you're here.
Alrighty. I have a skin condition that started when I used to have a beard, a very large beard. I was going to World Beard and Mustache Championships.
Are you serious? That's so cool.
I got a beard championship trophy. I mean, I've done all of that, and I would treat it with lots of different hair products. So by the time I shaved it, I think that I had developed a skin condition, and it just started to spread.
Does the rash prohibit you from wanting to wear the beard at all?
Yes, it does.
Well, I need to see what this rash looks like, so I need you to get into a gown, okay? I'll step out so you can do that. I'm hoping today with Devin that we can just meet his expectations. I want to fix his rashes, and I think I can do a good job with that. Alrighty, so let's see what's going on. I love how you did your gown.
Hey,
Very cute.
Okay.
I love it. But I might say to him, we just gotta get rid of the hair. If you wanna get rid of this problem, just get rid of the hair.
If the doctor were to propose that we have the solution, it's gonna take complete removal of your body hair, that would be really difficult to hear. That would be the worst case scenario.
Okay. Oh, yeah. Yes, yes, yes. So you have these, what we call erythematous, or red kind of scaly patches all through the hair here. Yes.
Seriously, dig in if you want.
I am. Devin does have a lot of body hair. He is a pretty hairy guy. He is also completely bald. Interestingly, both of those conditions were caused by testosterone. So the scalp, if you have hair loss, there are testosterone or androgen-sensitive areas that cause hair loss, whereas the beard in some aspects of the body, like the chest, is testosterone-sensitive hair growth. Is it okay if I just clip this little portion here so I can see it more adequately and visualize it?
Yeah, okay. Whatever you need to do.
Sometimes it's very difficult to examine a patient and to truly see how their rash presents if I cannot see the actual skin. We'll go ahead and start.
Okay.
And I'm actually, sorry.
No, it's okay.
Does it tickle or does it hurt?
You just go for it, you're fine.
Okay, hold on, maybe I'll go with the green. Is that better?
A little better.
So what are you wanting to do with the hair? Are you wanting to maintain it? Do you want us to get rid of it for you, or what are you thinking?
I'd like to keep it.
Will Devin have to get rid of his body hair? It really depends on the diagnosis. There are some times where I will recommend reducing the amount of body hair that someone has, and that's if the rash is so significant that reducing it will basically be curative. Okay, so yes, it does look like a form of seborrheic dermatitis. It's caused by an overgrowth of a yeast-like organism. It lives on everyone's skin, but some people get overcolonized. So in order to treat it adequately, we need to address the overcolonization of that yeast-like organism as well as the inflammation, okay?
All right.
But good news, you do not have to get rid of your body hair.
That's amazing.
So the way I would approach this is doing a multi-modality treatment, meaning that we don't just treat it with one thing, but we treat it with multiple things at a time to get a better result, okay? So it's gonna be a combination of oral medications, a foam to apply to the area, and then I'm gonna give you an antifungal shampoo as well. There's nothing really that Devin could have done to avoid getting seborrheic dermatitis. Some people get it, some people don't. It's kind of like acne. Some people get it, some people are blessed to never have a breakout, so this is very similar. After 2 weeks, you should look better. The other aspect of it that is just a little bit annoying is that it is recurrent, okay? Even if we get it perfect and you do not have this for months at a time, it will come back.
Okay.
Okay? So you're gonna repeat these things as needed.
All right. Unfortunately, this is probably something I'll be dealing with over my lifetime, but we're gonna be able to treat it, and they didn't have to remove any hair, so like it's really great. I can't ask for anything more. I really did not want to have to resort to removing the hair, and neither did my wife, I'll be honest, so this is great.
When he comes back, I'm hoping that he has no rash, that he's completely clear, and maybe he'll be more comfortable to grow that beard out, and we'll have like some nice facial hair when we come back. Well, take care. We'll get you going with the medications, okay?
Okay, thank you.
Very nice meeting you.
Nice to meet you too. If this problem goes away to a degree where it's like it's beyond managed, I'll come back like a phoenix. I will rise from the ashes, go to the World Beard Competitions. I mean, definitely beard trophy could be in the future. Thank you. Bye-bye.
Bye.
Can y'all like pause a little bit?
Yes.
Okay.
Absolutely.
I don't know if I can do this.
I'm treating Vaughn. She has alopecia areata. She has over 60–70% of her hair that is gone. So we're doing PRP injections, platelet-rich plasma, but she's not tolerating the injections as I've hoped. We're halfway done, just letting you know. Are you feeling hot or sweaty?
It's just painful.
I know.
I don't like needles, but it's something I want to try, so I have to deal with it. Can I get tissue?
Yes, absolutely. You're so brave, Vaughn. You're so brave. You're so brave. We're almost done. Literally, we have maybe like 5 pokes.
Okay. Okay. Let's do this.
Let's do this. I like your attitude. So we're gonna focus right in here, okay? Last one. All right. You made it. You did it. Vaughn did great, and she basically took over 30 injections in her scalp. And there was a moment in there that we had to stop, but that's normal. I mean, PRP is not just like a walk in the park, so I can understand her pain, but she did great. I'm very proud of her. You did it, and you know, I'm so thankful to have met you, and I hope we can continue this journey. We do this usually every 4 to 6 weeks, so we'll set you up an appointment. Alopecia areata is not just a one-time you fix it. It can take months. It can take a year or so to get that hair to actually come back. Okay, thank you.
Thank you. It was worth it. I'm glad I did it, and I'm got it over with. And I hope the next time I see you, I will have a full head of hair.
I'm about to perform a surgical hair restoration procedure on Holly. She suffers from trichotillomania, which is a disorder where she has pulled out her hair. So Holly's being prepped for surgery, and I can tell she's getting a little anxious about what's going on.
Now, typically I give patients a little medication to make you less nervous or anxious. Is that something you want? Yep.
Yeah,
Valium.
I probably need 2 of them. Be real loosey-goosey.
Yeah.
This is scary in a lot of ways. Scary can also be exciting. I think this is going to be absolutely life-changing, but there's just so many unknowns, and it's like diving into the depths of something. I hope I surface okay.
I hope you're excited.
I am excited. I know it'll be a long process.
Yeah, that's the biggest thing.
So what some people don't understand is the length of time that this procedure can take. It can be a 10-hour surgery day that we need to prepare these patients, that the length of time that they're going to be spending with me.
All right, very good. I'm going to leave you with Miss Teresa. She's going to finish getting you prepped and ready, and then I'll be back and we'll get this party started, okay?
All right.
All right, very good.
You'll feel a little stick, and then a little bit of a sting.
Oh, wow.
Is that okay?
It's not awesome.
Yeah.
The sensations involving getting numbed absolutely fucking sucked. I'm not going to sugarcoat that at all. Oh, fuck. It felt like fire ants and or wasps, like over and over and over and over. Oh.
You want me to hold your hand?
No.
No? Okay. I will if you want me to.
So Holly's donor area has been numbed. It's time to start the surgical procedure. I'm about to make my first cut. There's no turning back now.
So I'm just making an incision in the back here in the donor tissue.
Oh, wow.
You doing okay?
Mm-hmm. It's game time. In hair transplantation, every single hair counts. So I have to be so precise when I'm removing this specimen that I make sure that I don't transect the follicle or damage the root of the hair follicle because it'll die.
What I'm doing now is just gently removing the tissue that contains the hair follicle off of the scalp.
That is a weird
It's
feeling.
weird, isn't it?
Yes, it is. We're removing that donor strip. It didn't hurt, but you could hear it. The sound is really funny. It's like your head is iceberg lettuce, and they're just kind of cutting away at it, and then when they actually pull it away, it feels like pulling open a bag of onions or something. Like my head felt like produce.
All right, you ready?
Yeah. Oh, wow.
Look at that.
That is crazy.
Isn't that amazing?
It looks like a hairy version of sushi.
So you see that yellow part there?
That's the fat.
That's the fat. And if you see those tiny little black dots?
Yes.
Those are the roots of the hair follicles, and they reside in that yellow layer.
And that's going to be enough hair to do the whole thing?
I'll know maybe a little bit better when we get into the back. Now the next part is to pass that donor area off to my skilled technicians, who will then put that underneath the microscope and dissect out each individual hair follicle one by one.
This part of the procedure is very lengthy because you have to be very meticulous, very precise and intricate in dissecting the individual hair follicles out of that tissue to make sure that you don't traumatize them or damage them in any way.
And while they're doing that, I will start making the incisions where those final grafts are going to be placed.
That's so weird.
Not hurting though, right?
No, it just sounds like when you do needlepoint. It's a very auditory experience, which I wasn't expecting.
While I'm making the incisions, I'll stop at a particular point and I'll ask my staff where we're at so that I don't make too many incisions for not enough grafts.
So this is the moment of truth. We really want to get that graft number as close to around 2,500 if we possibly can.
All right, Miss Holly, so we finished dissecting all the grafts, okay? So we got 2,721 grafts out of your tissue.
Wow.
Yeah, that's fantastic.
That's amazing.
We had a record-breaking number of follicles that I've ever extracted on a female patient, just because normal female patients have female pattern hair loss. And another factor is women have small heads, and Holly's got a decent-sized head going on.
So for Holly, we were able to get this record number of follicles in a female in this one strip of tissue. These hair follicles are living organs with a clock that's ticking. You want to get those grafts back into the body as quickly as possible to increase the chances of survival.
I saw your hand coming up. I thought you was gonna reach up and scratch your head. I was gonna get ready to give you a beat down.
No, just the eyebrow. It's been 9 hours. And I am emotionally, physically, mentally, completely exhausted.
You hear the hair angel singing? This is the last one.
Damn. All right. For me, I've met my personal highest graft extraction number for a woman, which is 2,721 for Holly. And so that's just gonna make her result look incredible in 8 to 12 months. But in the meantime, her trichotillomania is not cured just because we gave her a hair transplant. So it's gonna be very important that Holly make sure she has the tools in place so that if she gets that anxiety or urge to pull, that we redirect that behavior in a positive way. So on the top, if you could touch it, because you're not allowed to, you would feel that there's little teeny tiny bristles of hair from the transplanted follicles. Okay. Now, don't be alarmed, remember, because in a couple of weeks to a month, potentially all these little hair shafts are going to detach from the root and you're going to see them falling out in your sink, in the shower, and when you comb your hair. Don't freak out. It's not the follicle coming out. It's just where the root's going dormant because it got scared that we moved it from the back of the head to the top of the head. So it's going to look just like you did before the procedure. And then it's going to gradually start to grow in.
Can you remind me how many days before I'd be able to lightly clip in my piece?
I would wait at least a full week before you put your piece on.
Okay. What I'm really hoping is that the healing process isn't too much or too complicated, and that doesn't trigger me to want to have my hands up there, because I've been really good about managing that and not engaging in that type of behavior. And it could absolutely be like overwhelming if my entire scalp feels like I want to go at it. So the next step is to go home and just make sure that I'm really taking care of my head so that we get the healthiest result. And when I see you guys next time, I'm hoping I'm gonna have a full head of hair.